Hi everyone, this is Maureen Maher. I'm the Educational Director and the instructor for our Pediatrics courses, and I wanted to talk to you a little bit about some of the changes that we've made. We're always trying to improve to the Pediatric Osteopathy Certification Program. And basically I've just made this video for those of you who don't want to take the time to read the whole course page, although I always encourage you to, especially the frequently asked questions. But just to be able to give you a quick overview so that you can maybe just walk away from being in front of your computer and listen to me talk rather than having to read. So one of the big changes that we've made to our Pediatric Osteopathy Certification Program is that although it still contains the same 4 basic courses, it now includes 4 mentoring sessions. Mentoring sessions with myself, which are generally done virtually, unless you want to come and have a one-on-one session with me at our training center in Montreal, which is where I'm located. But having mentoring sessions with the instructor, I think, is something that we are starting to include more and more in our programs, and I think it's something that you're actually really going to like. And the reason for that is that over the last several years, and especially with the pediatrics program, it's a very important subject to learn how to do well. The program in itself is 165 hours. Now will be, over 170 hours with the mentoring sessions. There's a lot of material to learn. You want to be comfortable working with newborns and infants and toddlers. And it's important to be able to have access to your instructor, not just in terms of a written email, where I've been writing feedback for online courses to people for 7 years now. And I have to admit, I'm a little bit over it because sometimes the questions are a little bit more in depth. And this is where a live discussion is needed, and it helps. And if I was a student, if somebody said to me, you'll have access for each course to have a whole mentoring session, generally I recommend that you schedule them around the time or maybe after you've done your homework for that particular course so that we can review them together, and that's probably the time that you have questions. So each of the 4 courses will have a mentoring session, a 90-minute virtual mentoring session with myself where we can review your homework, discuss it. I can ask you questions and you can also ask me questions. I can guide you. I've worked with infants from the time that I started practicing over 20 years ago, because I chose to study at a college that had cranial osteopathy as a very big part of the curriculum. And when you're an expert in cranial osteopathy, then you're going to attract a lot of newborns, because a lot of the conditions that you see in infants and newborns are coming from something happening within the cranium, sometimes something that happened at birth. And that's going to include all of our cranial patterns of dysfunction, the need for cranial molding in newborns, any type of latching or feeding difficulties. The glossopharyngeal nerve that is involved in latching and feeding is important. Even the vagus nerve in terms of any kind of digestive difficulty. You really can't practice pediatrics without being an expert in cranial. So myself, having been an expert in that, it's what I wrote my thesis in. I just naturally, in the community where I was, which is a real bedroom family-oriented community, I attracted a lot of newborns. So I started getting experience with that from the very beginning. So 20 years of working with newborns, I think this is where a lot of my knowledge came in, that I was able to put together these courses, and I really enjoy mentoring students. So I want you to take advantage of the mentoring sessions. If you're thinking of joining the program, one thing I also want to let you know is because you have up to 2 years to complete the program, we've created a new 24-month partial payment plan. Now, our online learning platform itself doesn't allow for us to create as many as 24 months. So if that's something that you want to make your payments even more affordable, spread over 2 years instead of over 1 year, contact us and we can set that up for you directly so that then you can go in and you can pay from your bank account, either by credit card, set it up for 24 monthly credit card payments, or even set it up for 24 automatic bank withdrawals if you want to circumvent paying by credit card. So that is a good option. We've always believed in having partial payment plans in order to help make your learning more accessible, and people take advantage of that. And so the pediatrics program is now available over 24 months instead of over 12 months. So that cuts your monthly payments in half. you now have one mentoring session with me for every one of the 4 courses, which is part 1, cranial dysfunctions, part 2, assessment approaches, part 3, digestive and feeding difficulties, and part 4, orthopedic, shoulder, upper and lower limb dysfunctions. When you go on the course page, when you see the 4 courses, if you click on them, you can scroll down and you can see the curriculum to get a little bit more idea of what's taught in the courses. So I won't go through that, but you'll also see on the courses that we have also included 7 different pre-recorded webinars that I've given on many of the subjects that are covered in those courses. So you can listen to the webinars separately. Generally, I would recommend that you listen to a webinar associated with the course that you're doing. 7 different webinars, 4 different 90-minute mentoring sessions, and 4 courses that are anywhere between 35 to 40 hours each. So the program is very complete. Now, cranial osteopathy is still a prerequisite. If you have studied at a college where your knowledge of cranial osteopathy is very advanced, so you know how to identify all of the cranial patterns of dysfunction, you know how to correct them, let's say on an adult, then most likely you don't need to take our cranial osteopathy prerequisite. But if you know the basics, but if I said to you, is that a torsion or a side bending rotation? And how would you go about planning to correct this based on what you found in terms of a whole overall bodily assessment of the person as well as the cranial pattern? Okay. That means you didn't learn it in school, and that's okay. Not every college and not every country puts an emphasis on a lot of cranial hours. Some in Canada do, some don't. I know which ones do and which ones don't. And so you're going to need to take our newly combined 65-hour cranial osteopathy course. Now, why do we have the newly combined part 1 and part 2 course? Because you really need cranial patterns of dysfunction. Even when you're assessing a newborn, it might not be so orthopedic. You might not be doing a postural assessment standing in, to the side view, but you are going to be doing myofascial assessments. You're going to see myofascial torsions within the bodies of newborns, and it's important that you know how all of that interrelates with cranial patterns. And so that's what you're learning in the part 2 version of our new 65-hour course, A Biomechanical Approach to Cranial Osteopathy. Also know that even if you take that course and don't go on to learn pediatrics, this is going to advance your knowledge so that you can start being able to treat cranial conditions, even on adults, in a much more thorough way. And oftentimes, cranial patterns, if they're not a result of a recent traumatic injury, oftentimes they're the outcome of a postural compensation that might have evolved over time. The same thing in a newborn. It can be an outcome of a myofascial torsion because of the way the baby was positioned within the uterus when they were born. So you need to have this knowledge to be able to correct things once and for all. And what I've noticed over the last couple of years is some of our students who didn't have this more advanced training in cranial osteopathy, when they came to do the first course, or even the other courses where cranial is an important part of it, I found their knowledge was very superficial. And you can't have a superficial knowledge of cranial osteopathy if you really want to fix cranial-based dysfunctions in newborns. It just makes sense. So the cranial certification program also has a 12-month payment plan. And because it is now a combined course, that course has also 2 mentoring sessions with me. Ideally, you would do the first cranial mentoring session with me halfway through the course, and then the second one at the end of the course, because it's divided into 2 parts, so to speak. So your cranial osteopathy, you have access to me too. And so then if you go on to do the pediatrics program, if that's what speaks to you, then you would have had a lot of mentoring sessions with myself. And hopefully you'll feel that that is something that adds value. Now, it has increased the enrollment fee in the pediatrics program ever so slightly. But when you think of the fact that my hourly rate for private mentoring or tutoring sessions is what it is, and I even had a student the other day say, that's very affordable as an hourly rate. And I said, well, I haven't increased my hourly rate for our existing students in several years because we want to make it accessible. So if somebody were to come to me who is not already taking a course with us, I would probably be charging them my full hourly rate for mentoring or one-on-one tutoring. But if you are having mentoring sessions with me, virtual ones, as part of a program, we've set it so that, for instance, in the pediatrics course, you have 4 90-minute mentoring sessions. And so that's actually, 5 hours or more than that, actually 90 minutes times 4 of my time. If you were to spend that many hours with a client doing treatments, how much would you be charging? Right? So that's why the pediatrics program enrollment fee has increased ever so slightly. Those mentoring sessions, we've made them affordable, accessible in the way that we've increased the enrollment fee, but we haven't charged top dollar. But I also can't give them away for free, just like the public should not be asking you to give away your time for free. So that explains why the pediatric enrollment fee is a little bit higher than it was in previous years. I hope you feel that it's money well spent. I know you will. There's always a lot of demand for pediatrics. And as I often tell my students who are thinking of enrolling, mothers will not quibble about bringing their infant in to see you. It's not like people who, are being encouraged by their massage therapist to come in for a massage once a month on a regular basis. They will come in as needed. And once you establish your reputation and the way that I train people in this program, you become a specialist. It's not a little extra something that you do. It's an area of specialization. So if you were a doctor, going to a doctor at a walk-in clinic versus a family physician in private practice versus a pediatric specialist, you know that in a lot of places in countries, in provinces in Canada, even trying to get an appointment with a pediatrician, MD, for your newborn is very difficult. And because of the extra training that they've done, they obviously make a better salary than a general physician at a walk-in clinic. It makes sense. And so when you train and become an expert in pediatrics as a manual osteopath, your fees and your income should also be higher. So the enrollment fee will pay for itself, not just because you'll have a chance to do what you want to do, but I'm also very much a believer that if you have advanced knowledge and if you've invested in that advanced knowledge, then you should be charging appropriately. Otherwise, what's the point of spending money on continuing education just to include those extra knowledge or those extra techniques or treatments, into your existing treatments, but your price is the same? I'm going to be better and better, right? But nobody out there in the real world invests in better and better, but still stays at the same salary that they had when they graduated from school, right? People expect to have a salary increase as they acquire knowledge over time. And so I'm a big believer in mentoring you in that sense, how to set up your plan and how to set up your clinic and your practice so that you attract people who are going to appreciate what you have to offer, see what a complete assessment is with you, and know that, wow, I might not have access to a pediatrician, you might not be a doctor, but you sure are knowledgeable. I'm so happy that I found you. And mothers tell other mothers, and doulas and lactation consultants and nurses, in the neonatal unit of hospitals will refer you clients. And I loved working with newborns, even though some people find, the crying that they do, and it's perfectly normal for them to cry the whole time you're treating them. I was able to tune it out, and I really enjoyed it. It just brought a certain warmth, maybe because I'm a woman, that I enjoyed working with newborns, and I found that it wasn't stressful. What was stressful was working with the moms who couldn't handle listening to their babies cry. And so for me, the additional stress and setup of my clinic to make sure that I could accommodate everything that newborns and infants need was worthwhile. I really enjoyed it. And now 20 years later, I'm able to share my knowledge with you and hopefully train, pass on my knowledge to the next generation. And it brings me a lot of pleasure to be able to do that. So that's just some of the updates of the pediatrics program. Know that the start dates that we have are, suggested cohort or start dates, meaning I try to have people start around the same time so that over 2 years, 24 months, if you're doing 4 courses, you're going to do 1 course every 6 months. So you might take 3 or 4 months to complete a course and then have your mentoring session with me, take a bit of a break, and then do the next course. And so we try to encourage people to start, the first course around the same time, the second course in the program around the same time, but those dates are not carved in stone. So if you say, oh, I want to start, but I can't start till the end of February, and it says January, February, what if I enroll in February and I can only start in March? It's not the end of the world. Our start dates throughout the year are suggested start dates. For instance, we don't have a suggested summer start date, but if for you, enrolling in the spring and then working through courses in the summertime for whatever reason works for you, then you can do that too. As I said, those are suggested times so that I can help keep you a little bit on track, so that you make sure that you finish the program within 2 years. Because if I have sometimes students who take too long and they're nearing the end of their 2 years and they've only completed the first course, I say, I'm sorry, but if there's that much lag in between, it's one of the preconditions for certification in the program. So you're going to have to speed things up a little bit. And so I work with students to try to set up a plan for them, so that how they can complete the rest of the courses within a reasonable amount of time that we deem reasonable, so that you're fitting in with the same criteria as everybody else in achieving certification. If you have any questions and you want to talk about possibly enrolling in the program, you're thinking about it, you want to discuss it with me, the best thing is to discuss it with the instructor, not just with your husband. Give us an email, send us an email at ceosteopathy@gmail.com. Amanda will send you the link to be able to set up a free chat with me. That's a free 20-minute chat during our regular business hours. I don't do chats in the evening. I actually reserve time during the week, a couple of days during the week, to chat with students, potential students who are thinking of enrolling in a course. So if you're looking for a chat in the evening, I'm not going to be available for that. But if you're looking for one during lunch hour, then that I can do. And I'll be happy to answer any of your questions, discuss if now is the right time. I always advise students, honestly, some people, are sometimes surprised when I say, I don't think this is right for you. Maybe what if you thought about going that direction? Sometimes some people study obstetrics with us, and they take the course in learning how to treat the pregnant patient throughout all of the stages of pregnancy before they actually go on to pediatrics. Maybe you'd like to do pediatrics, but you also want to work with pregnant women. And our course in working with pregnant women is an 8-chapter course that you can complete over 2 or 3 months, or shorter if you have access to women in every trimester of pregnancy. You could start for a year or two working on with pregnant women, and then look at committing to the pediatrics program later on when you're ready, if it's a question of time or finances or anything like that. But I hope that now being able to offer it over a 20-month payment period is going to be helpful to you, will not so much encourage you to enroll, but if finances was something that was preventing you from enrolling, hopefully then that's going to help, where you won't be held back by that. And like I said, when you go on the course page, you'll see there's a button that says contact us to set up your 24-month payment plan with these options. So if that's an option that you want, you have to contact us. We have to set it up for you separate from the online learning platform. If you have other ways that you want to enroll in the course, if you're a person who wants to enroll in everything right now and pay the full enrollment fee, then you'll find that the enrollment cost is a little bit, not substantially, but a little bit lower than if you were paying over a 20-month period. All right, so I hope that all of this has answered your questions. I hope our news about the program is something that is welcome to you. And like I said, if you'd like to set up a time to talk, there's no commitment. I'm just here to answer any questions if you're trying to think about whether now is the right time and how you should go about it. I'm not just your online instructor. I'm not just the voice and the person on the screen. I'm also your virtual mentor. All right, so everyone, hope you have a great day, and hope to be in touch with you soon, whether that be virtually or any of our in-person classes, hopefully coming up over the next few months in Toronto or Montreal. Take care.